my name is Brittany, and today we are going to be doing the respiratory assessment. So, newborn respirations for infants is going to be anywhere from 20 to 40 breaths per minute. With infants, they have an irregular, regular breathing pattern. So it's irregular for an adult, but it is normal for them. That's why we count for that full minute. If we only counted for a shorter amount of time, they could appear tachypnic when eventually they would normalize out and it would be a normal number. So again, that's 20 to 40 breaths per minute. They are abdominal breathers, so you can just watch their abdomen to count those respers. As far as nasal flaring, that should be absent. That would be a sign of respiratory distress. I'm also going to look for retractions. Those could be substernal, subcostal, intercostal, supraclavicular, and thankfully we don't see any retractions going on. If I were going to measure, I would measure at the nipple level, and then I'm just going to assess his respers. So I'm going to be looking at the rate, the rhythm, the depth of the movement of his abdomen and chest, and look for any grunting, again, nasal flaring, which we don't see, so that's all good. And then last but not least, I'm going to listen to his lungs. So I'm going to start out listening on the anterior side, and I'll be moving from side to side to compare both sides of the lungs. When listening to breath sounds, you want to listen for that full breath, all the way in and all the way out. After listening to the anterior side, I would lift him up. Sometimes it's easier to have a parent help with this part to hold the baby, but after listening to the front side, I would then listen to the back side, doing the same technique, going from side to side. That concludes my respiratory assessment.